Hi, everybody. It's Wednesday, September 15th, 2021, and we are joined in conversation with Dr. David Davenport, who is a specialist in infectious disease at Western Michigan University School of Medicine, along with Betsy Davison, the co-founder of Space for Arts. My name is Matthew Young. I'm a photographer, a director, and the founder of Art of Freelance. We were lucky enough to get the medical and epidemiological insights from Dr. Davenport at the beginning of the pandemic. The conversation we had with him was on April 27th, 2020, which is 16 months ago, but it kind of feels like 3 lifetimes ago. The insights that he provided were really helpful for me, and I know for many others, as we got back to work on set, assessing different risk factors, sort of navigating these choppy waters. And I think honestly, in the end, for me, keeping me safe for these last year and a half, being back on set, working in the midst of the pandemic, but around so many other people. There were times on set where we would have a producer or production or a COVID safety officer even who would be militant about people sanitizing their equipment, but not bat an eye at 10 people jammed into a small room with no ventilation. And the headline for me from our conversation last time with Dr. Davenport was that at the end of the day, no 2 productions are the same. There's this spectrum of risk that we as individuals need to learn to identify. And at the end of the day, it comes down to us keeping ourselves safe, knowing what questions to ask, what safety protocols to push for, and what lines we needed to draw. And that last conversation was really helpful in me sort of getting that insight. So again, Dr. Davenport, thank you for taking the time then, and thank you for taking the time again now. I think that I can speak for more people than myself when I say that I'd really hoped that we would be done with this conversation by now. And yet the reality is the pandemic is what it is. Here we are all these months later dealing with new variants and new spikes and new information. And so Betsy thought this would be a really great time to get Dr. Davenport to join us again to answer some more questions about how we can all continue to keep safe on set. So thank you again for being here and really looking forward to this conversation.
You're welcome.
So I think I'm going to get started. David, is there any good news about COVID a year after you answered all of these great questions for us for the first time?
Well, there's a lot of good news, but unfortunately for most people, it's not enough. We have a vaccine. We have actually a number of vaccines. We have 3 vaccines in this country. We've identified therapies, several different therapies. We've identified things that can prevent COVID from high-risk exposures. And I think those are the big things. So we know a lot more about this disease. We know how to treat it. We're following it much better. Our testing capabilities is dramatically increased, which is a big, big plus. But on the downside, we're still in the middle of things. Earlier this year, in the spring, we had models that thought that we had things under control. And about that time, the Delta virus raised its ugly head, and within 8 to 12 weeks, it became the predominant virus and changed the whole story. So we still have more of this pandemic to go. We have better tools to follow it and to treat people.
Okay, great.
That's probably the most of what I could say. The good news about pandemics is that no pandemics last forever. Eventually, the pathogen, the virus, and whatever its host is, in this case, it's us, adapt to each other. And we'll become better. Our immune systems will become better at fighting this virus or any virus off. And the virus will usually adapt to us because we are the virus's meal ticket. And viruses don't have any advantage in killing your meal ticket. So there's usually an adaptation, and eventually whatever we're left with the coronavirus, it'll be much more manageable. Which probably leads to another question you might want to ask, but I don't think this virus is going away. There's a lot of discussion about that, but more likely than not, we'll eventually end up with a kind of an endemic, a slowly smoldering kind of epidemic or spread, if you want, where the virus will still be there. It'll affect less people at the same time, and it'll be more manageable. But the idea that this is going away anytime in the near future is probably unrealistic, and we're probably looking at dealing with it as an endemic disease like influenza or something, one of the other respiratory viruses.
That's fantastic. Thank you. That was a wonderful intro. And there's so many questions within what you were just talking about, which leads to another great question. Is herd immunity possible at this point, or will vaccine hesitancy and virus mutations prevent us from achieving this?
Herd immunity is probably unrealistic at this point. There's a couple of reasons, but initially we were saying that herd immunity, we need about 70% of the people to have the vaccine or be immune. And with Delta virus, it's much more transmissible. So all those numbers change. There's mathematical formulas. And to actually reach herd immunity with the Delta virus, as it is right now, we probably need 80 to 85% of the people receiving the vaccine. And looking at the numbers, there's just no way we're going to get there. It's just not realistically going to happen. The only way we can get there is with vaccine mandates. And, I realize that mandates are unpopular in some segments of the society, but we've reached a point with a pandemic that, it has taken the lives of too many Americans and other people around the world, that we just don't have the luxury of asking people to get vaccinated now. And the only way we'll come anywhere close to the 80–85% that we need right now is with mandates.
Yeah, that's a tough one. I'm going to ask a couple more questions and then toss it to you, Mathieu. Dr. Davenport, you grew up in the time of polio. How bad has this pandemic been in relationship to other public health crises, such as past pandemics?
Well, this pandemic is clearly the same order of magnitude of the famous influenza epidemic of 1918, where a huge percentage of the world's population died. So we're clearly in that ballpark. In terms of polio, when the vaccines initially came out, the Salk and Saman vaccines, they were thought to be a godsend, and people were just thrilled to death. There wasn't any discussion about whether they were real or not real, and people lined up around the block anywhere they could get these vaccines. Currently today, we live in a very, very different society. We have people that are distrustful of the government. We have people that are distrustful of large corporations, large pharmacies. Unfortunately, this pandemic has been politicized in a way that's staggering. Add on top of all that is that we have social media, where anyone can be an expert. So it's real common these days to not believe what you hear and not believe what you're told. So it's totally different. If you told me 2 years ago that we'd be giving money or beer or marijuana to try people to get vaccinated, I would have never believed it. But in fact, we've seen that even now, with significant deaths and the rates comparable to the last wave, we still have a large segment of the population, 70,000 to 80,000 people in this country, that don't want to get vaccinated.
Dr. Davenport, one thing I was hoping you could help us with is providing some context, or making some of these abstract numbers and data that we hear about in the news a little bit more understandable or relatable. For instance, we hear about breakthrough infections a lot in the media, vaccinated people that end up getting COVID. And I was wondering if you could help us put into context how likely that is. And I know that there's a different likelihood of getting COVID, being ill with COVID, being hospitalized with COVID, but could you provide some context for how likely it is for a vaccinated person to get a breakthrough infection and get ill from it?
Yeah, I can. Actually, there's a recent paper that was published in the Lancet just in the last few weeks that looked at large populations. And the take-home message is that the number of breakthrough infections is far less than 1%. It's probably, I think, around 0.2%. So it's very, very unlikely. And the people that get breakthrough infections, you have to say, well, what exactly are you talking about? The majority of people that get breakthrough infections that are fully vaccinated have asymptomatic disease with no symptoms. There's a smaller number that have some symptoms, and there's almost no one that has serious life-threatening disease that puts them in the hospital or jeopardizes their life. So there are breakthrough infections, but usually they're mild. Sometimes they're asymptomatic. So it depends on what you're looking at. So sometimes when you see some of the other numbers, they don't take into account all those different variables.
Yeah, no, appreciate that. There's no easy, like, it's as unlikely as getting struck by lightning or something like that. Is there that you know of about being seriously ill with COVID if you've been vaccinated?
It's highly unlikely. The interesting thing, when you look at the vaccines that we have now, they're all three vaccines in this country, they're about 95% effective at preventing serious disease, hospitalization, and death. So if you want to think of what are the most important things to everyone, being seriously sick, being hospitalized, or going into a critical care unit and not making it. All three of these vaccines are very effective against the Delta virus, for example. So they're really good. Does the Delta virus, is that taking a hit? Is our protection against mild disease or asymptomatic disease less with the Delta virus? Yes, it is. But in general, that's not going to be a big thing for most people that are vaccinated.
Got it. One other question I had for you, again, in the media, I feel like I've been seeing a lot of articles about rising rates among children. Schools are back in session, but I've also read that there's very little data that shows that it's dangerous for children. The UK, I read in the New York Times, might not ever vaccinate children under 12. I'm curious if you can provide any more insight. This is a selfish question because I have a 1.5-year-old and an 8-year-old. And so my biggest concern, personally, is going on set, getting it and bringing it home to unvaccinated children. So just wonder if you could give us any more color insight into how dangerous this COVID is for children.
Children can still get the coronavirus. And when you're over 5 years old, the most recent data, the risk of acquiring coronavirus is about the same as adults. At one point, we thought it was less, but it's about the same as adults. When you're less than 5 years of age, the risk of acquiring coronavirus is probably about half of that. The good news is that most children have mild disease. They have mild disease that could even be a runny nose or the sniffles. In terms of how many children get infected, that number directly correlates with the number of cases you have in your community. The CDC has a website, cdc.gov, and you could look up community transmission and all that. And in areas where there's high transmission and a high number of cases, we see, a higher number of children with disease. But still, it's not selectively selecting children. They're just one of the large populations now that are unvaccinated. So children aren't totally protected. They usually have mild disease. There are some children with diabetes and obesity and other issues that can get very serious disease. And then there are some children that get this late multi-system inflammatory syndrome that's serious. But for most children, they'll end up having mild disease. All that being said, we need to do everything we can to protect children, which is why they say that children over 2 years of age should wear a mask and socially distance and all those other things. And as parents, what we can do, the primary thing we can do to try to protect children is what we say, create a circle, encircle them with immune people, create a large circle of immunity. That's what we used to call for vaccination, ring vaccination. But if children have everyone around them vaccinated, their chances of acquiring the virus goes down significantly.
When you describe those long-term inflammatory symptoms, is that what people are calling long COVID right now?
No, that's something else. There's something called multi-system inflammatory syndrome that can be quite serious and put children in, a critical care unit. It's very, very rare. It happens to some children, and it happens usually after they've had COVID. It's often maybe 1 to 2 weeks later or within the first month. So it's exceedingly rare, but it's also a take-home message that we need to do everything to protect our children. The other question that most people don't directly ask is, what is your risk tolerance for yourself going to work? Well, your risk tolerance is you're probably not in a frame of mind where you need to be 100% protected all the time, because it's just not going to happen. But if I ask you what your risk tolerance for your children is, usually the answer is 0. I don't want anything to happen to my children. And that's why we need to at least let people know that while it's incredibly rare, there are children that have serious consequences of this disease. And if you look at the number of children hospitalized in the United States, that's published daily by the American Academy of Pediatrics, it's still a significant number. But if you put that over all the children, the percentage is quite small.
David, I think we're going to jump to talking about production on set. We've got a number of questions a year later about that. What's your view a year later for safety on set? And, should we be thinking about a shoot that's done quickly and, put everybody there for the day? Or, do you shrink the crew and still spread it out over a few days? I know there's a lot of variables about shooting outdoors versus indoors, but just before we get into specific questions, sort of what's your overview a year later of being safe on set?
It's pretty much what it was a year ago, and there's not a one formula, one size fits all. It's always looking at the number of people, the space, the enclosed space or not, whether you can stay 6 feet away from other people, whether people are masking. All those things come into play, and there's not a simple answer. The thing that people have finally gotten, and they didn't totally get it maybe a year ago, is that ventilation is critical. And you can open windows, you can have fans, direct the airflow, but more and more people now are using, maybe Matt's already been on sets that has this, they use something called a HEPA air scrubber. They're actually like an air purifier, but they're like an air purifier on steroids. It's something used in industrial settings. And it has HEPA filters that filters out about 99% of the viruses and bacteria. And they can direct the airflow, usually create a negative airflow. And you set this up, you can roll them around, set this up, and then you have tubes and things, and you can direct them outside to a window or somewhere else. But I think people are more tuned into ventilation and ventilation solutions that are available now.
So this is a tricky question. If you're unvaccinated, should you be on set? And how should the crew respond to someone who's unvaccinated?
The simple answer for me is that you shouldn't be on the set, except in extenuating circumstances. The Delta virus that's the number one, that's 99% of all the virus in the United States right now. And it's so infectious. It's 5 times more infectious. And if you're unvaccinated and you get the Delta virus, you're 11 times more likely to die, or 10 times more likely to go in the hospital. That's just, for me, as a safety person, an infection person, that's kind of an unacceptable risk. So I don't think that should happen. There are some people that have some valid reasons for not getting the vaccine. They're very, very, very small. And if someone has a valid reason, and we have to go through a long list, there's very few, then they should wear an N95 mask on the set at all times, which means they can't eat, they can't drink, they can be there, but they have to have the mask fitted right, and they have to wear it at all times. times. It's just, this is a different virus now in terms of transmissibility than it was a year ago. So the stakes of the poker game have gone up significantly.
So just to reiterate, so we have it in one question. So the essential protective gear to wear on set is not a KN95 or, you know, a polyester shield. Like, should everybody now, now that you can have access to N95 masks, should everybody be wearing that kind of a mask? Or should they wear a mask and a face shield? What's necessary?
Ideally, mask and face shields. And, you know, now if there's an abundant supply of KN95 or N95, that's a much better mask. And we're trying to, you know, we're trying to have a layered defense with ventilation, with social distancing when possible, with barriers. And an N95 or a KN95 is like a 5-ply mask, 5 different layers, and it filters out, you know, over 95% of all that bacteria and viruses. The other masks aren't as effective. You know, the next step down is a medical mask or surgical mask, and that's 3-ply. That's better, but are 5 layers better than 3 layers? Yes. And then some of the cloth masks just don't really cut it unless it's a cloth mask that has an insert where you can put in a, you know, equivalent of a 3-ply or N95 filter inside the cloth mask. So you have cloth, 3-ply, 5-ply, 5-ply barrier, and then another layer of cloth on the other side. The other thing, of course, is that masks are worthless if they're not worn right. And if you watch TV every single day, you can turn on any news program, and it breaks my heart. About a third of the people aren't wearing their mask right. It's down below their nose, it's too loose, or they don't even have it, or it slips down all the time. So, you know, they're only as good as the people that use them. And if they don't use them right, they don't give you that layer of protection.
Been on a lot of airplanes in the past year, and the number of people that can eat one bag of Chex Mix over the entire length of a flight is pretty phenomenal. You know, you don't put the mask back up if you're just like constantly in motion from bag to hand. I'm like, how does that one little bag last 4 hours? It's almost impressive the lengths people will go through to keep that mask down under the nose. Would you talk a little bit about sanitization of equipment? How important is that? I've read some articles about like sort of performative cleaning that we do, and I still see it on set, people that are spraying stuff, wearing hazmat suits, spraying down locations before we get into them. Yeah, I mean, would you sort of put that, again, like in context? Like obviously all safety measures are great, but where do you think sanitizing surfaces and equipment ranks compared to ventilation, social distancing, masking, vaccinations, the other safety precautions that we take on sets? How much time and energy and money should we put into sanitizing surfaces and equipment?
Probably towards the bottom of the list. It's overemphasized. I think it got traction because the fear associated with this virus initially made people feel like, you know, we've got to do something, damn it. You know, and this was something that everyone could do. And it made a lot of people feel more secure. Predominant mode of transmission that you already know is through the air, through large droplets or small droplets. You can get it from surfaces. If someone coughs on a surface and you come by and put your hands on that surface and then rub your eyes or your nose, you can actually transmit virus from a surface to your eye, nose, or mouth. That's not the predominant mode of transmission. It's responsible for, as best we can tell, a very small number of cases. And the other thing is usually when you're infected that way, it's with a small amount of virus. And a small amount of virus, if you get infected, often is more likely to give you mild disease. So I don't think you should totally poo-poo it, but in the list of big things, that's probably way down the list. And, that's another reason for people wearing masks. If there's someone unmasked that's going around coughing on all your equipment, Should you be concerned? Yes, you should be concerned. But in general, that's not high on the list.
You should probably be concerned about that, not even just because of COVID, but just because somebody is walking around coughing on your equipment. How about these temperature checks that people are doing on every set in restaurants, in public places? How effective are temperature checks as a COVID prevention measure? And do they have some place in our life just to keep people with colds or influenza or other immune issues out of these public spaces?
It's not a very useful screening tool. One would hope if someone was sick and had a fever, they wouldn't come to work. That's not always the case, but there are some people that always push the limit. But beyond that, it's not very useful. In fact, one of the more troubling pieces of data that's come out recently, England has a public health service that collects masses of data from the whole country. They were looking at Delta virus. The predominant symptoms was a headache and a sore throat. Headache, sore throat, and a runny nose. And fever was not very high on the list. And a lot of patients with COVID don't have fevers. So it's not a very useful tool. It may be a useful tool to get people to stop and at least think about asking, am I healthy? Do I feel good? Should I be here? Do I feel sick? But to screen, it's a very, very poor discriminator.
Would it be fair to ask you to just rank our safety tools on set, like lightning round? Like if you could rank, and you can tell me if this is an unfair question, but if you just had to rank ventilation, masking, vaccines, social distancing on set, temp checks, disinfecting our equipment, anything I missed, is that a fair, is it possible to do a ranking like that for us to just sort of hear?
I mean, people have actually looked at that. I mean, it's different in different circumstances, but far and away, the safest thing everyone can do for being on a set is being vaccinated and being fully vaccinated. Far and away, that is by far our most potent weapon against this disease. The second most useful tool, of course, is masking and appropriate masking. The eyes, the face shield is less of an issue, but you can get infected through your eyes. And then the social distancing may well be able to prevent 80% of infections, provided you don't have an opera singer on the set that can blow out viral particles 30 plus feet. But those are far and away the most important thing. The other thing that I think that people forget about, and we may not have talked about it now, one of the all important things is the other safest thing you can do to have a safe set is, if you can, daily testing with the antigen test. The more you test, the better the sensitivity and the more likely you'll pick up someone that may be infected. The antigen test isn't the number one perfect test, but the antigen test is very, very good at picking out people that are capable of transmitting the disease. They have a higher amount of virus and the test is usually positive. There are people that can be incubating the virus and the antigen test can be negative, but they're usually not infectious. But 8 hours later, the next day, it could be a whole different story. So one of the best bangs for the bucks is to literally test people daily, test them with an antigen test. If you can't do that, if it's cost prohibitive, and this is some of the struggles you're seeing play out in different areas, schools and things, you need to do it at least weekly or ideally every 3 to 5 days. But both of those other options are a bit of a trade-off. If you want a safe set, test everyone with an antigen test daily. Be sure everyone's vaccinated. Be sure everyone's wearing masks. And then beyond that, the most important other thing, and I don't know where to rank it with those personal things, is ventilation. And I think I said on the last thing, some of the people in public health, we walk around and say, this little saying, dilution is the solution. You're literally trying to dilute the amount of virus. And the bigger the space, the more the airflow, that's that's a significant thing to prevent the infections. So those are the big things. And then when you get down to cleaning stuff and some of this other stuff, they're further down the list.
Thanks. That was really helpful, David. But included in set safety, especially a year ago, craft services, everything went back to single serve. How do you feel about, when obviously everybody has to have something to eat when they're on set on long days. How are we feeling about individual packaging? And, it's terrible for the environment, but, should craft services still continue on with single-use silverware and single-use packaging and that kind of thing?
Probably a good idea. Lower down on the list. It's still something that's recommended by the CDC and other regulatory agencies. And if you start to do things that are at variance with the CDC and other regulatory agencies, you will get some blowback. Is that real high on the list? No, it isn't, but it's probably a good idea. It's probably not a good idea, especially like to have a big salad where people are mixing and taking stuff out and picking over pieces of bread and stuff. So, a lot of it's, how much do you trust other humans, and if you are an observer of human nature, there'll always be at least 20 to 30% of people you work with or something that will distress you and won't seem to be doing all the right things all the time. Somebody with a mask that slipped down over their nose getting his food, So it's lower on the list, and it's probably a good idea to do, but it's not the most important thing.
Okay. And so oftentimes we think about production as being the traveling circus. We all have to take trains, planes, automobiles to get where we need to go, to get to set. And my question, even just for business, traveling across the country, you're on an airplane. You said that the antigen test is good if you're going to set and test daily. But if you're just traveling as humans, being exposed and being out there, let's say we're vaccinated, should we come back after a long business trip or trying to get to set and coming back? Should we be testing ourselves? Going to the store and buying the CVS test, over-the-counter test, and making sure that we're still okay so that we're not, we don't have that breakthrough infection. Like what's your thought process in terms of travel?
Depends on who you talk to, and also depends on your risk tolerance. For me, if I found myself in a high-risk situation, probably 4 or 5 days after the trip, I'd probably do one of those at-home tests. The incubation is usually about 4 to 5 days. It's different in different settings. And, it's something that's probably easy to do. Air travels in the plane is very safe. The number of air exchanges and the HEPA filters, all that's very safe. Where things fail is getting on the plane. The lines to get on the plane. God forbid, don't use the bathroom. And other areas of ticketing. And if you're a computer junkie, they talk in programs they call about choke points, things where there's a problem, things don't work. And it's the same thing with travel. While airplanes are usually very safe, there are some unsafe things to get on the plane, to get off the plane. And I don't think they do it anymore, but at one point when planes were delayed, they in the past, they had them on the ground with the ventilation off. Now that's very bad. I don't think they do it anymore. I'm not sure, but you kind of need to be aware of that. But if you go through a long trip and you're in a bunch of areas with lots of population mixing, lots of people and stuff, and you're concerned about your family like that, one thing you could do is like 4 to 5 days later, you could do an at-home test.
And let's say we are on set and it's a 2-week shoot and somebody does test positive. That person goes home. What about all the other people that are there that were exposed to the person that tested positive? Should the production shut down? Should they, what happens when that person tests positive? What should happen to that?
There's some different answers for different people, but classically in the hospital, people would have to go home for 10 days. What we're seeing more and more now for exposures, people that have been exposed, there's this movement that's called test to stay. And the idea is in the real world, in the business world, in the medical world, the hospitals, we don't have the luxury of sending everyone home that has the sniffles or everyone home that's been exposed. That just removes such a huge portion of the workforce. There's all kinds of emotional stress that goes along with it. So a lot of people that, particularly with exposures, are using kind of a test to stay strategy. Well, if you've been exposed, well, then you better be tested every single day. And if your test is positive, the other thing with the antigen test that I didn't mention, so I don't know if you have to ask me the question. If you have a positive antigen test, it should be confirmed with a PCR test. So it's a good screening test. But as we get more and more people vaccinated and immune, the chance of false positives, it's a statistical thing, it goes up. So if you have a positive antigen test, the next step for everyone is to confirm that with a PCR if you think you're infected. So that's a little off your topic, but I thought it was important to mention that.
Great.
Can I ask one quick follow-up?
Yeah, sure.
So, we don't get a ton of guidance, it feels like, for being in production from the CDC or OSHA. And that's why, this conversation is so amazing. And thank you again for doing this. But I'm curious what you think about taking some guidance that we see for schools, because like on this topic right here, I saw, different school districts are doing different things, different states are doing different things, but I've heard like if you are vaccinated and you are exposed, then you can test to stay. This is what guidance that I've seen for some school districts. If you are unvaccinated and you are exposed, then you need to quarantine. Are those sorts of guidelines that we're seeing for schools useful sort of parameters for us on set? Is that a good place to pull guidance from with a lack of getting guidance other places?
That's a really hard question. So it's a good question, but it's a very hard one. One of the question comes back to what is your risk tolerance? And our risk tolerance in the hospital is very low. Our risk tolerance for children is very low. Now, when you bring children into the equation, there's nothing right now more controversial than schools opening in this coronavirus. And since most schools are, the rules come from a local level, from a district level, they're all different everywhere. Even in a state or in one county, you can have multiple schools doing different things. And it's difficult. It's a bit tragic because there are some people that really want to do the right thing. And when they see 4 or 5 different schools that they thought, knew what they were doing different things, it's just self-defeating. In general, the test to stay hasn't been totally endorsed by everyone. I think it makes sense, but it once again depends on your risk tolerance. I think it's very, very good. You're going to pick up probably 90% of the people, 80 to 90%. When that isn't good enough, which may be in hospitals or schools, well, then you isolate. And there are, when you talk about people's children, people have very strong feelings, and there's a lot of people that want zero. Their risk tolerance is 0, and then that goes to isolating for 10 days. So it's a hard area. The other thing that people are really worried about is, I can talk about all the medical public health aspects of this, but there's an incredible amount of collateral damage going on now with children in terms of development, learning, all those things that I'm not an expert in. And there's a lot of people that are very, very worried that some of these children that have lived through the last 18 months or so have really lost out on something.
Got it. Yeah, I didn't mean to take us into the school policy discussion so much. No, I appreciate your answer, and I think that it was my question was maybe can I ask this? The test to stay. I haven't heard that before, and I haven't seen that implemented on set specifically as a policy. More often, unfortunately, I see people sort of testing at the beginning of a shoot and then being afraid to test during the shoot because they're afraid one positive case is going to shut the whole production down, because that has happened. So this test to stay idea, I think, is really interesting. And I guess maybe the follow-up question is there a difference between vaccinated and unvaccinated individuals in the test to stay versus quarantine conversation, or does that not matter?
The test to stay is something that people are real interested in now. It hasn't been endorsed by lots of people. People are looking into it. There's people doing research at UCSF that are big on that and other things. And they think, based on the numbers, and there'll probably be data that comes out, that's probably a pretty reasonable thing, but it hasn't been endorsed by everyone yet. So it's kind of hard. But when you think about it, and you think about the problems with a shoot or any type of business, it kind of makes sense, except in circumstances where your risk tolerance is zero. So I don't know if that answers your question. But I think for test to stay, you could say, if you want a definitive answer, stay tuned, because you'll probably hear more about it. You'll probably hear more opinions about it, and we might get a public opinion from the CDC if we're lucky in the next month or so.
Got it. You heard it here first. Well, you were the first one to school me on ventilation and how important that was, and that became the dominant conversation. So I trust you when you say that this will be in the mix here soon.
This is awesome. We hear it from David first. David, how do you feel about masks, and are they with us forever? I know you said it's going to be an endemic, meaning we're just going to be living with this, but I think there's a lot of anxiety and wanting to put that behind them. Can you talk a little bit about that?
Well, I think the masks are definitely here to stay for the time being. Based on what we have now, they're definitely here. Things may change in the future. Reminds me of a friend of mine that used to always break up with his girlfriend, and I would ask him, "Is it over?" And he'd say, "It's definitively over for the moment." And that's kind of where we are. Right now, I think everything we have says we need a layered defense, because we don't have perfect immunity with these vaccines. They're 90-95% effective. They're incredibly effective against preventing serious disease, but they don't necessarily do that so well in the elderly and the immunocompromised. And we don't know yet how long these vaccines will last. And most vaccines, contrary to popular belief, most vaccines' efficacy wane over time. So we don't know the slope of the curve, and we don't have good clinical data when people need boosters. And with these variants, with widespread multiplying of this virus, it's like putting the virus at slot machines, to get a variant of concern or something that hurt us. And as long as that's going on, well, we may continue to see new variants emerge. So it's kind of worrisome. There is some data that there's only so many amino acids in the spike protein, and there's only so many ways they can recombine. So some people think there will be convergent evolution, that at some point, maybe some people think maybe this Delta variant is as bad as it can get. And if that's the case, well, then the future may look good, because we're starting to manufacture and investigate vaccines specifically for the Delta variant. So, but for masks, they're definitely high up on the list and necessary with no exceptions for the moment. Like my friend that was always breaking up with his girlfriend.
Okay.
Long time.
Definitive for now.
definitive for now. I love that. David, we just have a couple more questions and then I think we're going to wrap. Just following up on what you said. So we don't know how long the the shot provides immunity. So I'm assuming boosters are here to stay with us as well as masks. Is that correct?
I think everyone that deals with this really thinks we're going to need a booster. The official statement right now is we don't have any definitive proof that we need boosters to prevent severe disease, hospitalization, or death. We know that antibody titers go down over time, but we don't have a specific cutoff based on clinical data of what is a low titer, and does that mean you need to be revaccinated? You know, your immune system is those antibody titers. It's also cell-mediated defense, that all those things come into play. So we don't really know that. So they're not recommending it now. It's under active discussion. I think probably in the next month or two, you'll probably hear something about boosters for everyone every 6 to 8 months, but we don't honestly know. And there's some ethical and political fighting going on that, you know, we have all the vaccine in this country and many developed countries, and the majority of the world has no vaccine. And for the world, there's less than 2% of everyone on the earth that has been vaccinated. So here we are, and for the World Health Organization, it looks very bad when the United States and other countries start giving boosters to their population when the rest of the population doesn't even have access to a vaccine. So that's another non-scientific story, but a good one.
So, Dr. Davenport, you riffed last time we spoke this amazing analogy for risk assessment using photography terms to make it land for all us photographers. This idea of, you know, our control settings on the camera, the ISO, the aperture, and the shutter speed relating to the amount of virus we're exposed to, for how long we're exposed to it, and sort of our sensitivity. I think it was the analogy. Maybe you could just walk us back through that analogy and then talk through what's changed now with Delta.
I think the analogy is pretty good. The ISO is how sensitive, how susceptible you are to getting infected, so to speak. And the ISO also would depend on, in this case, the virus, which in the camera would be photons, but the Delta variant has changed that you're going to blow out your pictures a whole lot easier. With Delta virus, you better stop down your aperture to the smallest one you have and the short shutter speed, because Delta virus can grip you and take hold of you, you know, like chicken pox, or 5 times quicker and better than what we were dealing with a year ago. And the other thing is just exposure. And like when you're indoors, the longer you're indoors, the greater the risk. There's lots of studies, people in restaurants and bars, the longer they stay, the greater the risk. It obviously has to do with the amount of exposure, and that could be analogous to shutter speed. If you have your shutter open for a long time, it doesn't take a whole lot of bad juju to mess up your shot. And then the shutter speed is the same thing with time, just shutting it down. I thought it was a nice analogy because I know photographers are used to varying those things to get the same result. So when you're doing risk assessment, you can kind of make a duration, population, mixing how many people were there, all those different things. And then if you're immune compromised, or God forbid you haven't been vaccinated, well then your chance of ever getting a good shot without blowing out your camera is not very good.
So like the ISO, you know, we've gotten more, the virus is stronger, so we're more sensitive to it. So the ISO has risen, but if you get vaccinated, it sort of drops it back down somewhat, and wearing a mask is like putting an ND filter on your camera that can darken it down an extra couple of stops on your aperture, and making sure that you're not in a dangerous environment for too long, so you don't blow out your photos or get the virus, is another sort of safety stop. One last question, Dr. Davenport, you mentioned early on that this might change from a pandemic to an endemic, sort of be similar to influenza, and we learn to live with it. Would you speak to that just a little bit more? Like, how far away are we from this being like a flu that we live with? I know you don't have a crystal ball and see into the future, but do you see that as the most likely logical sort of conclusion of this pandemic, is that we sort of understand our own risk tolerances and learn to live with it?
I think most people that do what I do, that study this, including big leaders, think it's unlikely that this is going to go away. So I think it'll become endemic, but if it's endemic like the common cold, which is a coronavirus, you would probably say no big deal. So I think it's going to be with us for some time, and like I mentioned before, the virus will adapt, and our immunity will get better at fighting off these infections. And in the end, we'll end up with something that's not too serious for most people. But if you ask most people whether they think this is going to go away, the answer is no. A lot of people would like it. And then the question about herd immunity is the same thing. It was something that everyone kind of grasped onto. It was nice to think that if we could get to the 70% vaccination rate of the entire public, it would go away. And that's probably not going to happen. And now the stakes, the bar has been set higher with Delta, 80, 85%. It'll probably be around for a while. It'll probably be less of a big deal. It'll probably be easier to manage. We won't be wearing masks forever. What's the time frame? Nobody knows. We're hoping right now that Delta is the worst virus we can have in terms of transmissibility. That's our hope. We don't have any proof of that.
Dr. Davenport, it's been absolutely amazing. Thank you so much for this incredible conversation. We always learn so much when we get the opportunity to chat with you. Matthew, I'll let you wrap things up, and we'll let David get back to work.
Dr. Davenport, thank you so much for joining us today, for all of your insights, for the measured and logical approach that you take to this. For me, similar to last time, I'm taking away this idea that understanding your own personal risk tolerance, understanding the risk assessment of the situations that you're walking into, and then trying to look at this layered defense and prioritizing, right sizing the actions that you can take as an individual, as a production, as a producer, the things that we can do and focus on, and those layered defenses to keep everybody safe is just such great information and such useful, actionable tools. So we appreciate you taking the time again to speak with us. And Betsy, thank you for setting this up and all of your great questions and research and insights going into this. This was really helpful again for me personally, but I hope also for lots of people out there as we think about how we continue to work out there in the world and be safe on set.
Thank you so much, David. And we will see you again soon.